Hello, welcome to any community. In this particular video, we're going to discuss the concept of Sukhasadhya Vyadhi. What are the Lakshana or the features of Sukhasadhya Vyadhi? We are going to discuss in this particular video. The term Sukhasadhya Vyadhi is comprising of three different terms: Sukha, Sadhya, and Vyadhi. The Lakshana, they are nothing but the features which are indicative of the Sukhasadhyata of an illness. Sukhasadhyata refers to easily curable disease as such. Charaka says, Hetavaha pururupani rupani alpani yasya cha न च तुल्यगुणो दोषो न दोषः प्रकृतिर्भवेत् न च कालगुणस्तुल्यो न देशो दुरुपक्रमः गतिरेकानपत्वं च रोगस्योपद्रवो न च दोषश्चैकः समुत्पत्तौ देहः सर्वौषधक्षमः चतुष्पाद उपपत्तिश्च सुखसाध्यस्य लक्षणम्. So if you split this particular shloka, hetavaha purarupani rupani alpani yasya cha na cha tulya guno dushyo na doshah prakritihi bhave na cha kala gunaha tulyo na desho durupakramah gatireka navatvam cha rogasya upadravo na cha doshascha ekah samutpattau dehah sarva aushadhakshamah chatushpada upapattischa sukhasadhyasya lakshanam. So if you know this particular, if you expand this particular shloka, hetavaha pururupani rupani alpani yasya cha. If the hetu or the etiological factors, pururupa or prodromal symptoms or the clinical features or rupa, which are observed in the individual, they are of mild nature. The nachatulya guno doshyo, doshya responsible for the vyadhi should not be similar to vitiated dosha. It is being mentioned that so the pitta dosha is having the relation between the rakta and sweda. So that means if the person is suffering from the pitta dosha dominant diseases, there should not be the involvement of rakta or sweda. So that should be that. Na dosha prakritir bhavet. In the sense, the prakriti of the individual should not be the prakriti of the disease manifestation. So that means if the person is suffering from pitta dominant disease, if he is pitta prakriti, if he is having the pitta prakriti, definitely it is considered to be difficult to cure. Or if the person is suffering from either, if the person is having either vata prakriti or kapha prakriti, in that particular situation, the disease may be comparatively curable. Then nachakala gunastulyo, in the sense the time responsible for the disease occurrence should not be conducive to dosha vitiation. For example, if the person is suffering from the pitta dominant disease, it should not be occurring in the either Varsha Rutu or Sharad Rutu, because they are considered to be the natural progression of the pitta dosha that may happen in those time period. That's why nachakala gunastulyo. So that means the time factor should not be conducive to the vitiating dosha. Na desho durupakramah. In the sense, the disease afflicting the part of the body should not be difficult to cure, or otherwise, if that should not be the involvement of the marma, etc. Then the gati reka, there should be only one roga marga, or the movement of the dosha should be from one direction, should be there. Navatvam cha, the disease should be of recent onset. The rogasya upadravo na cha, the suffering should not be the complication or upadrava of any other disease as such. Then, doshashchaikaha, the disease should be produced by single vitiated dosha. Either that should be either vata or pitta or kapha. It should not be either vata, pitta, etc. It should be either it should not be like vata, pitta, and kapha dosha vitiation should not be there. Then the body should able to withstand, that is deha sarvaushadakshama, withstand the any potency of the medicine. Either it should be milder potency, or it should be moderate potency, or it should be strong potent medicine. The body should be able to withstand. Then chatushpada upapattischa, all chikitsa chatushpada are four limbs of the treatment. should be present while receiving the treatment. If this is being observed, then it is considered to be Sukhasadhya Vyadhi as such. The same is being mentioned in Ashtanga Hridaya, that is Sarva Ushadakshame Dehe Yunaha Pumso Jitatmanaha Amarmagu Alpahetvagra Rupa Rupo Anupadrava Atulya Dushya Deshartu Prakriti Pada Sampati Graheshwanagunesh Ekadosha Margo Navaha Sukhaha. So here the almost the same description that is available in case of the Vagbhata also. Now we are going to the each of these one by one. If you think about the Alpa Hetu, so there are two images. Of course, the term Alpa Hetu that is actually used as a relative term. For that, you need to know about the another meaning also. So whenever if you think about the cigarette smoking, so here two images wherein the person on the left side is actually smoking one cigarette, whereas on the right side the person has taken the many cigarettes as such. In that particular situation, the person who has smoked only one cigarette, that will be associated with milder dosha vitiation, whereas the person who has taken multiple cigarette smoking, then in that particular situation there will be the dosha vitiation may be even much more severe. So that's how the person who has consumed or they smoked only one cigarette, they will be having the milder dosha vitiation. As far as curability is concerned, the person who has smoked only one cigarette, he will respond to the treatment very rapidly than the person who has consumed more amount of the cigarettes as such. Alpa Purva Rupa. In the sense, the Purva Rupa should be of a milder one. Or whenever, if you look into these two images, the left image is showing the person who is having the milder dosha vitiation, whereas if you look into the right image, that is showing the much more dominant Pururupa as such. Hence, the person who is considered to be having the milder form of the Pururupa, it is comparatively easier to cure than the Pururupa that is considered to be having the much more severe form as such. Alparupa. Whereas if you look into the left image, the clinical presentation is of one particular part of the body itself. Whereas on the right image, we are going to see the clinical manifestation throughout the body. Hence, the person who is having the localized clinical manifestation, they will respond to the treatment rapidly. Whereas the widespread disease manifestation as such, that will be showing the very long response to the treatment as such. That means the easily curable ones are the diseases which are having localized manifestations. Whenever if you think about the Nachakul Tulya Gunodushyo, that means, so here let us take the image of the previous image. So that is indicative of the person is having the Pitta dosha dominance. So that means we are knowing that the Pitta dosha is having the, what do you say, that the similar to the qualities of Rakta and Sweda. So that means the person should not have the vitiation of Rakta or Sweda as such. So that means the qualities which are considered to be having the Snigdha, Tikshna, Ushna, Lakhu, etc. So that will be responsible for the increase of Rakta or Sweda. Hence, the guna which is similar to the Rakta and Sweda should not be present. Then it is easily curable. Na prakritihi dosha, in the sense. So here, the same image, it is considered to be the Pitta dosha dominant disease. The person should not have Pitta dosha prakriti. In that particular situation, the person may respond to the treatment early. Nachakala gunastulyo. So that means the extreme left image, let us show that, and the right image that is showing the locality where this particular person may be residing. In that particular situation, we may expect to have the increase of Ruksha and Shita quality in the body. In that particular situation, that is comparatively difficult to cure. So, if that is not the case, then it is easily curable. Nateshu Durupakramaha. In the sense, the Durupakrama Desha, either it should not be afflicting the genitals, where the individuals are not, what do you say, that they are reluctant to give the illness or the discomfort of them. So hence, that should not be there. Or the multiple joint affliction should not be there, or the Drupakrama Deshaha. So that means there should not be the involvement of the Marma as such. If that is the case, definitely we are going to expect the incurability of an illness. If that is not the case, it is easily curable. Eka Gatihi. So that means the one Roga Marga or the one Dosha Gati should be afflicted. We know that the Urdhva Adaha Tiryak Gati. In the sense, the vitiated dosha should move in the urdhvagati, that means upward direction, or that should move in the adhogati or downward direction, or that should move in the tiryagati, that is in the oblique direction. Now all the three gati, if the dosha movement is there, then it is difficult to cure. Or otherwise, there is the other way of the dosha gati. So that means the vitiated dosha that should be present in the either in the abhyantara roga marga, so that should be present in the alimentary canal, or that should be present in the bahya roga marga, or that should be present in the madhyama roga marga. If the vitiated dosha are present in multiple roga marga, then it is again difficult to cure. Whereas in the extreme right image, the person is having the affliction of a right knee joint, left knee joint. So that means the giving the treatment to that particular left knee joint is comparatively easy. Whereas if the person is having the multiple joint affliction such as this middle image, so then it is considered to be comparatively difficult to cure. So that means ekagatihi should be there to have the easy curable approach as such. Further, if the vitiated dosha are present nearer to the elimination of the dosha, for example, if the person is having the vitiated dosha present in the mouth, or second individual, the person is having the presence of the vitiated dosha or pathogen in the stomach. The one that where the pathogens are present in the mouth, they are comparatively easier to cure than the pathogens which are present in the stomach as such. So that is the idea behind ekagatihi. Navatvam cha. In the sense, so that is the onset of the disease or the duration of the disease manifestation. So there are two examples, Mr. X and Mr. N. So Mr. X is having the duration of the illness of 3 days. Wherein the day 1, the person is getting the appearance of the symptoms, and day 3, the person is having the visiting the doctor as such. Whereas the Mr. N, they will be having the appearance of the symptoms on the day 1, but day 10, he will be visiting the doctor. In that particular situation, the curability of an illness will be in the Mr. X, not in the Mr. N as such. Na rogasya upadravaha. So that means the complication of the disease should not be present. To say that should be Sukhasadhyata of the disease. For example, the person is suffering from skin disease. There should not be any pus accumulation in the skin, which is considered to be an upadrava of that particular disease as such. Or otherwise, the other diseases which are mentioned to be having the affliction of rasa. For example, Ashraddha, Charuchushchasya Vairasya Marasadnyata, Hrillaso, Gauravam Tandra, Sangamardo Jvarastama, Pandutvam Srota Samruddha, Klaibyam Sada, Krishangata, Nashogne, Rayatha Kalam, Valaya Palitanija. That should not be there. Whereas Raktadhatu affliction, as far as they are concerned, Kushtavi Sarpabedaka, Raktapittamasriktaraha, Gudametrasya Pakashtapliha, Gulmutha Vidradi, Nilika Kamala Vyanga, Piplavastila Kalaka, the Drushcharmadalam Shutram Pama, Kothasramandalam. If they are present, then that is comparatively difficult to cure. Or otherwise, the Rasavaha as well as Rattavaha Srotomula should not be afflicted. Rasavaha Srotomula are Hridayam Mulam Dashacha Dhamanyah, that should not be afflicted, or otherwise Raktabhasroto Mul, Yakrit and Mu Priha, that should not be afflicted. Whenever if you are saying the person is suffering from the Kushta type of the diseases as such, plus chronicity or recurrence of the same illness that is being mentioned previously, and the person should not have the reduced Rogi Bala. That means the person should be having the optimum strength, and occupation etc. should not be predisposing factor. For example, if the person is suffering from the respiratory disease, he should not be having the occupation of working in the farm or working in the dust etc. etc. should not be there. In that particular situation, it could be leading to incurability of an illness. Then eka doshaja, in the sense it should be having the one dosha affliction only. There are two images. Suppose that the person on the left image is having the pain in the right index finger, whereas that is indicative of the vata dosha involvement only. Whereas on the right image, he is having this pain as well as swelling in the right index, middle, and ring finger. So that is indicative of a vata as well as kapha dosha vitiation. In that particular situation, the person who is having the vata dosha vitiation, they will respond to the treatment rapidly, whereas the person who is suffering from the vata as well as kapha dosha vitiation, they will respond to the treatment much later. Sarva ushadakshamedehe, that means whatever may be the uh, potency of the medicines, whether it may be milder medicines, so that means whether it may be taken either orally, or the person who is going to take the either the herbal or herbo mineral preparations, or the person is going to consume the either the potent samshodhana line of treatment, so that is vamana or nitya shodhana etc., or the person is going to take rakta mokshana at such, or otherwise if the person is able to respond pathya and apathya etc., or counseling sattva vajaya etc., if the person is able to withstand whatever may be these treatment modalities, then it is considered to be Sukhasadhya Vikara. Then Chikitsa Chatushpada, if they are optimum, in the sense the person is the skilled clinician, he can able to identify the dosha dominance, he can able to identify the possible dusha afflicted, if he is able to identify the srotas afflicted, if he can able to identify the exact location of dusha samurchana, if he is able to identify the proper the sadhya sadhyata of an illness etc., then that is considered to be the one of the major indicator of a Sukhasadhyata of an illness. As far as the Aushadha is concerned, if the person is going to have or the particular the hospital that is having the adequate amount of medications, maybe the what do you say that the drugs that are used for Dipana or Pachana, the drugs used for the Vamana, Virechana, etc., or the drugs which are used for Nitya Virechana, etc., or the adequate amount of the rasash, the herbo mineral preparations are being present or not present, then in that particular situation, it is considered to be Sukha Sadhyata in nature. Then the third aspect, that is the Paricharaka. If the person Paricharaka or the person who is a therapist, if he is able to do Abhyanga properly, or if he is able to do the Nadi Sveda properly, that means there should not be any kind of the boils etc., blisters should not be formed, or if the person is able to give the what do you say that the Vamana properly, Uttara Basti properly, or the Virechana properly, Basti properly, etc., then it is considered to be one of the indicator of a Sukha Sadhyata of an illness. Then the Rogi, that means the person should be able to give the exact presenting complaint regarding his duration of an illness, regarding his severity, regarding the aggravating and relieving factors, regarding the any associated diseases they are being prevailing at that particular time period, and regarding the surrounding of the area where he is residing, etc., if he is able to give the exact details, then that is considered to be one of the indicator for predicting the Sukha Sadhyata of an illness. To sum up, the Sukhasadhya Vyadhi, that is comprising of three words: Sukha, Sadhya and Vyadhi. Sukha refers to easily, in the sense with ease, Sadhya in the sense curable, and Vyadhi refers to the disease. The diseases which are easily curable, they are considered to be Sukhasadhya Vikara. The Lakshana they are being mentioned for Sukhasadhya Vikara are Etavaha Purarupani, Rupani Alpani Yasya न च तुल्यगुणो दोषो न दोषः प्रकृतिर्भवेत् न च कालगुणस्तुल्यो न देशो दुरुपक्रमः गतिरेकानवत्वं च रोगस्योपद्रवो न च दोषश्चैकः समुत्पत्तौ देहः सर्वौषधक्षमः चतुष्पाद उपपत्तिश्च सुखसाध्यस्य लक्षणम्. So among these, one Rogamarga affliction, the diseases which are of recent onset, etc., are the criteria of Sukhasadhya Vyadhi. That's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.